Hello folks out there. Hi, my name is Dr. James Lee and I am in medical practice in Southern California, and I am board certified physician through the American Board of Internal Medicine. Over the last 30 years, I've been practicing medicine, and I've seen so many patients with many topics of medical disorders and conditions. And now I have gotten to the point where I would like to expand care and education on a more broad spectrum basis, so that I am reaching out to you and sharing information with you. Hopefully I can guide you and educate you so that you can have a healthier life. And I believe this is really great because through internet system we can actually do this. And I'm very much pleased about this entire procedure here. So many of you probably do have a hypertension, which I'm going to be talking about today as a very first topic. And it is most common disorders of adult, and it is affected worldwide regardless of ethnic background. Basically hypertension is there, and sometimes it leads to a lot of serious complications and even death. However, if you detect your hypertension on time and treat on time, there's a great success story that you will be fine, and you can prevent a lot of complications from the hypertension itself. So I think you need to understand a little bit better about hypertension, what's involved. So let's go over it, and I will just start with one session and follow by second session. However, you may need to take a little note as you go along, and maybe ask your doctors about the questions that you may arise with this video. Anyway, welcome, and welcome to a medical consultant video, and hopefully we'll have a good relationship, and hopefully this video will be very helpful to you. And that is the really reason that I'm doing this. So hypertension. So what is hypertension? I think you probably need to understand the definition of hypertension. Now, before we get to that point, you need to understand a little bit of a background and terminology, so that if you're ever having some discussion with your provider about your hypertension, you may have a better understanding of what he's trying to say to you. So when it comes to the high blood pressure issue, and whenever we take the blood pressure of a patient, you get two numbers, upper number and the lower number. And upper number signifies the highest point of vascular pressure within your vascular system when heart contracts. It's known as a systolic pressure. The lower number is exactly opposite. It's the lowest blood pressure within your vascular system when heart relaxes. So having said that, now you need to know what the normal blood pressure is. And this is a little bit tricky and a little bit difficult to understand because everyone has different blood pressure. Normally, if you look at the medicine textbook, it says 120/80, and that's probably a well accepted range known as a quote-unquote normal blood pressure. However, 110/70, 130/90, are they really abnormal? Truth is that no, both all within normal limits, one in the lower limits, one in the upper limits. So when I say normal blood pressure, it's based on 120/80 blood pressure, but plus minus 10 milligram mercury on both number. So it can be minus of 10, it can be plus of 10. If you go on the minus side, then we say low normal blood pressure. If you go to upper end, we say upper normal blood pressure. Possibly you may nearing borderline hypertension class. Nowadays we say that stage 1 hypertension. So based on that, now we need to actually diagnose you whether you have a normal blood pressure or high blood pressure or even low blood pressure. So how do you do that? I think now you have to start taking your blood pressure at home and start monitoring your blood pressure and making sure that your blood pressure is very steady. You don't have any erratic changes up and down. However, blood pressure can be affected by so many different factors, including diet, environment, exercise status, your sleep pattern, your anxiety, depression, all the mental illnesses can actually affect your blood pressure. So it is very wise to use your discretion. What's really affecting my blood pressure? There are two types of blood pressure in general term. Number one, known as essential hypertension. That is the blood pressure usually through the genetic gene, and you get inherited through the family. So if your father, mother, or grandfather or grandmother, or even prior, whoever had a hypertension, they can transmit their gene to the next offspring, and you may end up carrying that gene, and later in your life, now the blood pressure starts to rise. So we call that essential hypertension. Second type of blood pressure issue is known as a secondary hypertension. And secondary hypertension means that you're carrying a other comorbid condition. And because of that comorbid condition, you are actually developing hypertension because of that condition. Good example of it is a chronic kidney disease, liver disease, any autoimmune disorder such as rheumatoid arthritis, lupus disease, and so on and so forth. So there's so many other conditions can affect your blood pressure, and not to forget about type 2 diabetes and type 1 diabetes and high cholesterol as well. Even thyroid condition can cause high blood pressure, so you have to really do the investigation of what's going on underneath. If you didn't have any kind of hypertension in the past and suddenly you're showing hypertension, probably you do require some workup, and it's better to consult with your own doctor and do some blood work and do some workup for that. So over the last 3 decades of my practice, a lot of my patients ask me, hey doctor, what's the main symptoms of hypertension? And I said, that's a very good question, because truth of the matter is no symptom is the most common symptoms of hypertension. So we call them silent killer, which means that although you're running high blood pressure every day, you just don't have any symptom at all. So you feel like you have normal blood pressure, and yet underneath of it, your pressure is high. So therefore keep damaging your important organs, especially your heart, brain, eyes, and the kidneys. However, if you're a lucky person and your high blood pressure is giving you some symptoms, these are the common symptoms that you may experience. And number one, unexplained headache, unexplained nosebleed. You have some exertional shortness of breath, which means that at resting you're fine, but you're trying to do something, especially uphills or upstairs going up, you may experiencing some shortness of breath. Dizziness and lightheadedness is another very common conditions, or sometimes a little more rigorous symptoms like a chest pain or the swelling of your lower leg, and blurred visions as well. So these are not always, but it is very common symptoms that some symptomatic hypertension patient report. So how do we then going to diagnose you with hypertension? Okay, very good question. So per definition, you have a hypertension if your blood pressure is above 140/90. Upper number 140, lower number 90. And used to say there's a borderline hypertension, but we no longer use the terminology because now the previous borderline hypertension, now we are classifying them into stage 1 hypertension, 140/90 and above, up to 150, we say you have stage 2 hypertension. Upper number 160 and above, we say stage 3 hypertension. And anything above 170, there's a stage 4. Anybody with upper number greater than 200, that's known as a hypertensive crisis, which means that any given moment, you may end up getting a lot of complications, such as a stroke or heart disease. The way to check your blood pressure is that, again, using 140/90 pressure as your guideline. So you have to have a 2 separate blood pressure measurement and consistently over 140/90, which means that you take one blood pressure after full 10 minutes of a rest and then record that blood pressure, and if it's above 140/90, then wait another 10 minutes or 20 minutes and repeat. Now that's your one occasion. Now next day you do it one more time with the same condition, and again you're running higher than 140 or 190 or equivalent, then per definition you do have a hypertension, and that's how you diagnose hypertension disease. So many of you already probably have a home blood pressure measuring device, and a lot of you probably do know how to use them and use them correctly. However, over the last 30 years or so, I've seen so many patients reporting their home blood pressure to me. However, your machine calibration was off. Sometimes they had a very wrong technique of taking home blood pressures. Therefore, that alters the pressure reading at the end, so it gives us very false information. So I would like to show you and demonstrate you how to use your blood pressure machine at home. There are two types of home blood pressure machine, and one can be manual, which I don't recommend for patients to use because it does take auscultation technique, and it takes two people, which means that you're the patient and you may have to have another person such as a nurse or your spouse or whoever know how to take the manual blood pressure. So therefore, for general term, I don't recommend that because often they make a mistake recording the right blood pressure. So having said that, the better machine is here, like device right here, and you can get this machine anywhere literally. You can even search to the Amazon.com, and they carry very many different type of automated blood pressure machine, and these are sufficient and good enough and very adequate. So the way to do it is, when you purchase the machine, you basically fill the backside with adequate battery, make sure the battery is fully charged. Then your cuff. Now when it comes to cuff is a very important part of the device right now. So if you have a thin arm, then you probably have to purchase the smaller cuff, or if you have extra thick arm, then you have to get extra size or oversized cuff. Otherwise, your blood pressure reading is going to be very, very different than what you're actually having it. So if you use a wrong cuff, such as very thin arm with a very large cuff, your pressure reading is going to be very low, falsely low. Oppositely, if you have a big arm person taking their blood pressure with a too small of cuff, then his pressure reading is going to be extremely high, which means there's a false positive, which means that he does not really have hypertension, but he reads as hypertension. So it's very important and critical to have a right size of cuff that goes into your arm. Most of adults are in fact falling into the range of what we call medium size right here. As you can see, I'm not sure if you can see it or not, but here's the medium size of cuff. This is probably good for almost everyone out there, so you can try out with a medium curve, and then you go with either smaller cuff or larger cuff later on to see which one fits the better. But anyway, if you're to use a medium cuff size like this, now the very important thing is you have a right posture. So you basically get you into a very comfortable position, very natural position without any tension after a full 10 minutes of rest. And then you find very quiet spot, and then you start measuring your blood pressure. So when you put the cuff on, there is a little dot right at the holes that are coming out of the blood pressure, and that's the actual spot that you should go on right on the brachial artery of your upper arm. Brachial arteries that are running through underneath of your elbow and up. So make sure this portion and the dot is right at the path of brachial artery like this, and then you're in the right position, and then make sure the entire the cuff surface is touching the skin and tightly wrap around it. And then in anatomical position, not too medially this way, inner side, not too much away, or not too above or too much low. So basically what you need to do is, in a very natural position like this, make sure your brachial artery, and which is the left arm, if you're to do with the left arm, so right at the level of your nipple line or a little below your heart. In between the underarm and the chest cavity area should be around 15 degrees apart, which means that about this way. And that's very good blood pressure position. And then when you get into the right position, then wait another minute or two, take a deep breath like that, relax your mind. Sometimes you can close your eyes, and whenever you are ready to go, then you basically press start button. By doing so, as you can see, cuff now to get inflated, and all you have to do is just wait until the machine finishes the reading. So after measuring your blood pressure, one thing that you need to do, that is to record your blood pressure on a piece of paper, or some people like electronically, so they use Microsoft Excel or what have you. Start recording, so date them, and then say AM and the PM, and underneath of that block you start writing blood pressure readings that the machine is giving you, and that's a very important recordings that you're doing. If you have any extraordinary situations, like such as you feel very anxious about things, getting mad, angry right after the exercise, and what have you. So if you have any kind of reason that you need to record what happened to the blood pressure, you may have a little bit of the event explanation, what you are doing right next to the blood pressure reading, so that later on when your doctor reviews your records, he or she can actually put that into consideration and make a decision. So the recording is very important for you to establish home blood pressure pattern, and you can actually take the recordings to your doctor, and doctor can review your blood pressure pattern at home, and then he can come up with adequate and probably very appropriate diagnosis of hypertension. So today we overview the hypertension in general, and most importantly, I demonstrated how to use your home blood pressure machine adequately. So hopefully you will learn something out of this session. Next time I see you, hopefully, I will be talking about then how to treat the hypertension with the different types of and classes of medications, and the things that you need to do in order to make your lifestyle improved, such as a diet, exercise, sleep, and etc. So treatment part of hypertension is extremely important, because that's what it's all about, and that's how we prevent further complications and the bad nature of long-term hypertension complications. So hopefully we'll see you again. Thank you very much for seeing my video today, and hopefully in the future with the many different subjects I will be discussing with you. Hopefully you will continue to follow me and give me a good thumb up in a way, so that we can actually continue to do this for the sake of your health. Thank you so much for watching. Bye-bye.